The Ministry of Health has spent $1.4 billion on outsourced diagnostic tests under its universal public health services. Health Minister Dr. Christopher Tufton gave an update on the Public-Private Partnership Initiative in Parliament this week.
The Health Minister says his team is working to enhance healthcare service delivery by improving access.
The project was designed to work with the private providers of diagnostic services as part of the Ministry of Health and Wellness short and medium-term strategy for the reduction in wait time and to alleviate the overcrowding in hospitals through outsourcing of those diagnostic services at no cost to the patient.
He says the project is aimed at addressing certain deliverables under the Universal Access to Public Health Services system.
1, access to diagnostic services. If our hospitals do not have those diagnostic equipment and can't provide those services, removal of social cases, and the outsourcing of elective surgeries.
Minister Tufton says the project began in 2019 and over 40,614 tests have been completed under the diagnostic component.
It means that 40,000 plus Jamaicans who more often than not would have been in a public hospital waiting on a CT scan or an X-ray, but the equipment was either absent or not working, were able to go to a private provider under contractual arrangements with the government to access those diagnostic services. And I know, Madam Speaker, that our members of Parliament can relate to this, because many of those persons, when they can't afford it, end up right in the MP's office to ask for them to pay for the CT scan and pay for the X-ray and so on. Well, under this program, the government has provided those services once we can't provide it in the hospital.
According to the Health Minister, services such as CT scans, ultrasounds, mammograms, fluoroscopic studies, and more have been done at a cost of about $1,421 million.
In healthcare, Madam Speaker, when those who need it most and could not afford it were able to get it. The 40,000 plus tests completed to date, Madam Speaker, CT scans accounted for 65%, MRIs 13%, and ultrasound 16% of examinations requested by the different hospitals on behalf of their patients, with a higher percentage of females, 53% of the 40,000, accessing services, and 46% being males.
Dr. Tufton says the program is in keeping with providing equitable, universal health services in the public health system.